Uh, First, at birth. At birth, we know we give BCG, then OPV, zero dose, and hepatitis B, zero dose. Given only single dose, that's why BCG not given any number. Zero means at birth. Okay, and for the BCG, some points. BCG is given if in neonatal period it is in dose of 0.05 ml intradermally in which hand? Left upper arm. What is cause? What is the reason behind giving in only in left arm? It is just protocol. If the parents are illiterate and if you're going to ask him whether the BCG immunization has done, apart from the scarring, many of times scar is not there. So how you going to ask the parents? If you ask the parents if the vaccine is given on left upper arm, then it should be BCG. Okay. If the examiner is asking you what will happen if BCG is given on right upper arm, nothing will happen. It's just protocol. Okay. The next point, I'll take some points related to BCG only. Okay. First point is dosing. If patient is in neonatal period, it is given as 0.05 ml. If patient is beyond 1 month of age, then dose should be 0.1 ml. Okay. Then protection of BCG. Protection. It will give 80% of protection. Means efficacy is 80%. Okay. And BCG protects only from the maximum from CNS tuberculosis, miliary tuberculosis, and disseminated TB. And it is having poor protection from pulmonary TB. Okay. And the route is intradermal. Then what happen if BCG in neonatal period given 0.1 ml? Why it is given as 0.05 ml? Because the neonatal skin is very thin and there is chances for injection to go deeper and cause abscess and tender local lymphadenopathy. Okay, that's why in neonatal period it is given in less dose. Okay, and the last question regarding BCG is why BCG only given till 1 year of age? Why it is not given beyond 1 year of age? In India, what they think, by 1 year of age, exposure to TB has already occur and patient is already developed immunity. That's why that is which is similar to BCG. That's why in India, what they think, after 1 year there is no need to give BCG vaccination. Okay, okay. Coming towards the next. Coming towards pentavalent. Sorry, OPV we have done. Sorry, BCG we have done. Then hepatitis B related some questions. Hepatitis B, zero dose should be given within 24 hours. Why it is not given beyond 24 hours? Because the purpose of hepatitis B vaccination is to prevent peripartum infection of hepatitis B. Okay, as India is LMIC, matlab lower middle income country, so there are plenty of cases which are not being immunized with hepatitis B or which is unbooked cases. That's why hepatitis B is an additional vaccine which is given within 24 hours of life. Okay, the dose is 0.5 ml. Okay, in OPV0 is given orally 2 drops. दो बूंद जिंदगी के. Okay, and here Rota 5 drops. Okay, coming towards the next at 6 week. At 6 week we'll give pentavalent 1 OPV, first fractionated IPV, first Rota, first, and PCV 13 first. Okay, What comes under pentavalent? DPT, hepatitis B, and Haemophilus influenza B comes under pentavalent 1, 2, 3, 4, and 5. Okay, so some points regarding pentavalent. Pentavalent is repeated on 6 weeks first dose, 10 week, then 14 week. Okay, then if you ask that a patient is not immunized till 1 year, मतलब catch up immunization is there. So what what are the schedule for the catch up immunization? If you ask, particularly which vaccines to be given in unvaccinated child age 1 to 5 year who comes to you in OPD. Okay, patient age is catch up immunization below 5 years. Okay, first visit DPT1 you give. Here is the point I need to tell you, after 1 year don't give Pentavac. You need to give DPT after 1 year. Then OPV1, MR1 and vitamin A 2 ml orally. In case of second visit, OPV2 given after 1 month, then DPT2 also given after 1 month. Okay, then next visit at 6 months. You have already given MR on first visit, so MR2 given after 6 months. Okay, and the booster of OPV and DPT at least 6 months of OPV3 and DPT3. If you listen carefully, after 1 month OPV2 has given, and on the same visit DPT2 has given. Okay, next matlab, on third month you can give OPV third and DPT third. Such 3 dosage of DPT has been completed and OPV has been completed. So after completion of the 3 dosage, you can call patient at a 6 month. So at 9 month you can give OPV3 and DPT3. Okay, and vitamin A dosing done every 6 monthly to remember. Okay, okay. Then we have done at 6 week. Let me tell you another one, next one, which is 10 week. At 10 week, 16, 14. Okay, 10 week you have to give penta 2, OPV 2, and then rota 2. Okay, penta at 6, 10, and 14. Okay, OPV 0, 6, 10, 14. Okay, and the rota at 6, 10, 10, and 14 week. Okay, then coming towards the 14 week, it is given as penta 3, OPV 3, rota 3, and fractionated IPV 2 and PCV 2. These are two additional dosing need to know about this. Here you can make one point that on 6 and 14 week fractionated IPV given along with PCV 30. Okay, or the next, then at 9 months. 9 months MR1 1, then PCV booster, then you can also call it as PCV3, then vitamin A below 1 year 1 lakh, that is 1 ml. Okay, at 9 months, and then 16 to 24 month MR second dose should be given after 6 months. You have seen in catch-up vaccination. Okay, here you can see the MR dosing in on the first visit we have given MR1, and after 6 months we have given MR2. Okay, so regular 9 plus 6 months is what? 15 months. Okay, so between 16 to 24 months you can give MR2. Okay, DPT booster. You know that after 1 year we don't give penta. Then OPV booster 1, DPT booster 1, OPV booster 1, and vitamin A dosing. Okay, and then after this, at 5 to 6 year of age, you can give DPT booster 2. Okay, and at 10 years you need to give TD instead of TT. It is banned now. And at 16 years of age can give TD. Okay, what about the pregnancy? As the pregnancy also comes under national immunization schedule, so we need to deal with this pregnancy. First dose of TD is given as early as possible, and the second dose 4 weeks after first dosing. In case of second pregnancy, if within third 3 year of a first pregnancy, both booster both TD doses given in the pregnancy only single time. Okay, if the second pregnancy within 3 years, booster dose has been given. After 3 years, two dosage have been given. Okay, then some points regarding vaccine. Other vaccine, the routes of vaccine. OPV, then Rota and vitamin E. OPV given as 2 drops, Rota given as 5 drops, and vitamin E given as 1 ml. Okay, then intradermal. You can give BCG and fractionated IPV as intradermal and subcutaneous MR and JE given as subcut. Oh, sorry. One points need to be added in the previous slides uh, regarding JE vaccine. Japanese encephalitis vaccine has been added in national immunization schedule in endemic areas. In endemic area only, it is given at 9 months first JE and at 16 to 24 month second JE dosage given. Okay, it's short. And what about intramuscular IM pentavalent DPT and hepatitis B and PCB booster. All are given intramuscular. Okay, the BCG, the dose of BCG is 0.05 ml and zero point 0.1 ml. Okay, then what about the other dosage? Generally, fractionated IPV is given as 0.1 ml intradermal. Okay, all other vaccines like AMR given 0.5 ml, JE 0.5 ml, Penta 0.5 ml, DPT 0.5 ml, hepatitis 0.5 ml. You need to consider these two vaccines which are exception for injectable vaccine. Except BCG and fractionated IPV, all other vaccines are given in the dose of 0.5 ml, whether it is subcut or whether it is intramuscular injection. Okay, then some points need to be clear regarding OPV vaccine. If mother says that I have given vaccination just few seconds before, can I breastfeed baby? Yes, you can feed baby immediately if OPV given. Can OPV given along with Rota or vitamin A drops? Yes, you can give vitamin A, Rota and OPV at same time. Okay, just revise, just revision of national immunization schedule in a single page in IS. Okay, at birth, BCG, OPV, and hepatitis B. Then at 6 week, Penta, OPV first, IPV, fractionated IPV first, Rota first, and PCV 13 first. Okay, at 14 weeks, Penta, sorry, at 10 weeks, Penta 2, OPV 2, Rota 2, and 14 week, Penta 3, OPV 3, Rota 3, then fractionated IPV 2, and PCV 13 2. Okay, and at 9 months, MR1, PCV booster, then vitamin A. 15 to 24 months, MR2, DPT booster, OPV booster. Okay, along with vitamin A. And at 9 months, you need to give JE1 in endemic cases and JE2. Okay, and at 5 to 6 years of age, you can give DPT booster second. Okay, at 10 years old, TD 16-year-old TD. Okay, that's it. If you have any question regarding this, you can give comment. Okay, thank you.